11 million Canadians are currently living with diabetes. This includes type 1, type 2, undiagnosed, and pre-diabetes. This affects a staggering amount of Canadians, and that number is only expected to rise. In fact, by 2032, that number is expected to be 14 million, which would be roughly 35% of our population. Thankfully, research into managing this condition is ongoing, and caretoknow.ca is always available to share the latest. Dr. Christine Palmay is here today to discuss GLP-1 receptor agonists, a new class of type 2 diabetes medications that is becoming more popular for its added benefits. Welcome back, Christine.
Thank you, Candace, for having me again.
So let's talk about it. What are GLP-1 receptor agonists and how do they work to control hemoglobin A1C levels in people with type 2 diabetes?
Such a new and exciting area of research. GLP-1 is a natural protein in the body. GLP-1 receptor agonists are a new class of treatments in Canada for the past decade that work to control your sugar levels. So typically we talk about hemoglobin A1C, which is a measure of the average blood sugar over 3 months. GLP-1s work in four ways. The first is targeting the brain by telling your brain cells that you are not hungry. The second area of target is the stomach, and it actually slows down the digestion of food. The class of medications also work on the liver to change the way that glucose is regulated. And finally, they work at the level of the pancreas, targeting insulin. So that four sets of action actually result in better blood sugar control.
So I'm curious, do these work in conjunction with insulin or on its own?
It's an excellent question. So typically speaking, these drugs are used in combination with other agents that we have. Less likely insulin, but some other oral agents. And in some cases, we're using them as sole agents because they are so powerful. Again, that's an ever evolving field.
All right. Well, how are GLP-1 receptor agonists typically administered then?
So we have two options. Some of the medications are injectables. Actually, most are. And then one of the medications also comes in a pill form. But in my clinic, and if you speak to my colleagues, most people are using the injection method. And depending on the type of GLP-1, some are injected daily, some are injected weekly.
But there are some exciting extra benefits to GLP-1 as well, correct?
Absolutely. I often describe the class as having a credit card with extra benefits. So the extra benefits include weight loss, and obviously that is, the topic du jour on TikTok and Instagram with Hollywood. The medication itself has been repurposed for weight loss, and eventually in Canada will be done so officially. And the second benefit, and I think equally as important, is cardiac protection. Certainly with type 2 diabetes, you're at an increased risk of developing a stroke or heart attack. And these medications, beyond the blood sugar control, actually help protect against those terrible outcomes.
So, what are some tips then for preparing for a doctor's visit to discuss GLP-1 treatment, and what should you be asking your healthcare provider when it comes to that?
Great question. It's always important to be educated and prepared. So, number one, obviously monitoring your blood sugars, bringing in your readings, either you can bring them on a piece of paper or the actual glucometer itself. Understand other parameters of diabetes control. So know your weight, your blood pressure. Talk about family history. If you have a family history of cardiac disease, know your own family, your own history. So know your particular history with respect to, your weight loss journey, cardiac issues, and just have questions ready. Are you interested in an injection? Are you interested in a pill? Do you want something that can be administered weekly? Do you prefer something daily? Those are all nuances that allow you to make the best decision for yourself.
When it comes to diabetes, are there other things that the science is, as the science evolves, that are coming to light now, new treatments besides GLP?
Absolutely. Now we're understanding that other medications come with other classes, combination of medications can be used. our goals now are very far-reaching. If you looked back or looked backwards 50 years, some of these healthcare advancements and improvements simply did not exist, and we now have diabetics that are living well into their late years and are doing so without tragic outcomes such as cardiac disease, kidney disease, etc. So information is really blooming, and education is absolutely essential.
All right. Well, tell me then how Care to Know can help Canadians learn more about type 2 diabetes, including the latest treatments and management strategies.
Education is empowerment. I encourage our listeners to check out caretoknow.ca. If you subscribe, it is number one free and also hassle free. Information will be delivered to your inbox, a wide array of health topics, obviously diabetes, but we also cover women's health issues, skin issues, and our repertoire of topics is ever growing.
All right. Wonderful. Thank you so much for joining me today.
Thank you for having me.